So when we initially described the new 501YV2 variant, we were concerned about four things. First, is it more infectious? The answer to that is yes. The best evidence we have to date suggests it spreads about 50% faster. Second, is it cause more severe disease? The answer to that at this stage, which is preliminary, suggests that it's not more severe. Our admission rates are not higher in the second wave. Our case fatality rates are not higher in the second wave. And evidence also from the UK with the VOC variant that they have are also not seeing greater severity. If you've naturally acquired the coronavirus before, does it escape your antibodies and your immunity? The answer to that is yes, it seems so. That the three mutations that occur on the most important part of the virus, called the receptor binding domain, that those three mutations, together with a few other mutations at the N-terminal, they enhance the ability of this variant to escape convalescent serum immunity. So when you take serum blood from those people who've had this virus before, and you put it in relation to the virus and you see if it kills the virus, the answer is no, it doesn't. It looks like the virus is able to escape those antibodies. So the concern is, are we seeing reinfections? The answer to that is not readily available, because protection against a strain of a variant of the virus, a new variant, is not only dependent on antibodies, it's also dependent on T-cell immunity. So those studies are still underway.
When we talk about the vaccine, there have been efforts to develop vaccines that are out now. Are these vaccines efficacious with this variant?
There's no question the vaccine is a major component of our efforts to control this disease. We have to appreciate that this virus, like all other viruses, is going to mutate. All of them do. And as it mutates, it will find ways in which the immune pressure of vaccination will push it and change it in particular ways. And so we may have to end up, enhancing our vaccines over time.
So how does this variant in South Africa compare to, for example, the one seen in Great Britain? There's also a variant in Nigeria that they're studying. Japan also found a new variant.
So when we look at the VOC variant, which has been described in the UK, that variant has one mutation in the receptor binding domain, which is at position 501, compared to the 501YV2, which has three mutations in that same protein. So it seems that the variant, the 501 variant that we've described in South Africa in December, has more mutations and so more opportunity to escape antibody immunity. And I think we're going to see in all of these other variants, we're going to be seeing differing kinds of mutations, and all of them will have differing impacts. Indeed, throughout the world, there are many different variants. They just don't concern us too much because they do not have major mutations in the receptor binding domain.
And finally, Professor Salim, what is the significance of these developments with the future efforts to contain the COVID-19 pandemic?
When we look at the 501YV2 variant, or any of the other variants for that matter, one of the most heartening things that we can take away is that our current diagnostics work just as well with the new variants as they did with the others. Our treatments work just as well with the new variants as they did with others. And our prevention strategies work just as well, whether it's wearing of masks or social distancing. All of those elements remain the fundamentals and are as effective against the new variant as they are with the old pre-existing variants. So we can take heart that our essential tools for diagnosis, treatment, and prevention remain effective. What we have to do is redouble those efforts. redouble our efforts to protect ourselves to reduce the spread of this virus. Redouble our efforts to ensure that because these viruses spread much faster, that we take even more and greater precaution in the way in which we expose ourselves to risk. And I think if we do that, we can bring these new variants under control, just like we did with the others.
Dr. Salim Abdool Karim, thank you so much for joining us. We appreciate your time.
It's a great pleasure. Thank you very much.